more times about to go to the hospital. Maybe he will be spend a long times to go there and come back. So I prepare the case in here. Told you about before this class. I can see the all information in the internet in the hospital. I can use the data in here. Maybe you don't need to go to the ward, to the hospital to see the patient, but you will see your sign. You can, if I show you your case in here and you have a problem, I will be go one step, two step, three. And like the CN asked me how to differentiation this patient is normal or a cancer. I just want to everybody know this step. As a clinical doctor, is very important to all the students. So, welcome. The first speaker. Thank you.
So today we are going to discuss about lung cancer. Let's see what it is. First, before going to the lung cancer, let's review some anatomy. So, as you all know, this is the trachea. It's the trachea and it can divide as bronchi. The bronchi is again gonna divide. This is the primary bronchi, secondary, and tertiary. Beyond the tertiary bronchi, we're gonna see the alveoli, from which the air is gonna exchange for oxygen and carbon dioxide is gonna come out. So this the gaseous exchange happens in the alveoli. What is lung cancer? Lung cancer is uncontrolled growth of abnormal cells that start off in one or both lungs, usually in the cells that line the air passages. The abnormal cells do not develop into healthy lung tissue. They divide rapidly and form tumors. Is that clear?
Yeah.
Okay, I have one question here. Cells that line the air passages are bronchi. So what are the cells that line the bronchi? Alveoli. Where is alveoli? Alveoli is towards this, right? The tertiary, here, somewhere here, alveoli, right? From which air exchange happens. So, what are the cells that line the bronchi? Yes, there you go. Epithelial cells. Yeah, that's the important thing, okay? Remember. Another thing is, abnormal cells do not develop into healthy lung tissue. Remember that. Normally what happens is, a normal cell gives rise to another normal cell, and this is gonna die sometime and this is gonna develop. So in lung cancer or any other cancer, that thing doesn't happen. This abnormal cell is gonna divide and gives rise to many abnormal cells. That's the deal. Okay. This is what happens. Here I wrote something, cell divides with the help of DNA replication. If there is a cancer, it means there is some problem with the DNA first in the cell. So, if the DNA is broken, mutated, damaged, or whatever happens to the DNA, the problem with the cell starts, and the cells start dividing abnormally, and gives rise to tumors. See, this is the abnormal cell division. This cell starts mutating. I mean, the DNA is getting damaged, so it tries to repair itself. It can't, and it starts to give rise to abnormal cells. So, before going to the lung cancer in detail, we got to know some classification about this. Small cell lung carcinoma and non-small cell lung carcinoma. Here, in this, we're going to discuss about the non-small cell lung carcinoma. This is the epithelial cancer and this is central, and small cell lung carcinoma is peripheral. Peripheral in the sense it can be above the bronchi, above the primary bronchi, and to the different parts. It can spread to other parts of the body like cervix, prostate, liver, and GI tract. And so that's it. See, small cell lung carcinoma is gonna be till here. Sorry, non-small cell, and small cell is gonna be till here, and the non-small cell carcinoma is gonna be here, here, and here, and to other parts of the body. So is that clear about the classification? It's very easy. Non-small cell lung carcinoma stays within the lung, stays within the epithelium of the lung, from where it grows. That's it. And small cell lung carcinoma is that. Is this clear? And these are the some. So I told you why the abnormal cell is gonna grow. Normal cell is gonna divide and make a copy of it, replica of it. So abnormal cell divides and form into abnormal cell because of these causes. Because of these causes, a tumor is going to develop. Okay, so there are some genetic factors like hereditary, and smoking is one of the major factor to trigger lung cancer. 90% lung cancer start from the smoking, and we can take as half of it as secondary smokers. Okay, like exposure to radon gas, and asbestos, which is greater than 10%, and occupational and environmental factor. So you might have a doubt that how radon gas, we inhale radon gas, right? So radon gas produces from soil. It produces from soil. It has been said that trees emit radon gas. Trees emit radon gas, and it emits and it stores in the homes, and also when we have some basements in the home, it gets stored there, and we inhale it, and this is how we get it, from radon gas. So these are this is the pathophysiology we're going to see here. Let's see from here the microscopic structure. I cut open this and I'm going to see how it is. Okay. So this is the epithelial cell which you are going to see. I cut open this and I see in the microscopic structure, this is what I see. So the epithelial cell which are glued together, and this is how air passages from this. Okay? And next, so let's say this cell has been mutated. This cell has been mutated, damaged, or something happened, so it grows uncontrollably. It grows uncontrollably, and what happens? Form many other tumors. Gives us to many abnormal cells. And so, since it gets damaged, mutated, and start growing uncontrollably, so what happens? The airway obstruction happens. The airway can't pass very easily. And then so this is what it happens mainly, then the symptoms are going to start like wheezing, airway obstructions. Because of airway obstruction, wheezing is going to start. Next, if there is an infection in the cancer patient, what happens? So how an infection is going to cause normally?
Bacteria.
Yeah, of course, bacteria too.
Virus.
So yeah. So when we inhale bacteria or any dust we carry has some bacteria like that. Okay. So it's very hard to remove the infection which is past the tumor. See, I have mentioned here it being dots. You can see it. So it is very hard to remove the infection which is past the tumor cell in a cancer patient. So what happens? As there is an infection, what is the first reaction the body is gonna react?
Fever.
Okay, so immune response is gonna trigger.
Yes.
Okay, so there is gonna immune response trigger. Infection first, and then immune reaction. So from immune reaction, the blood cells, the vasculature becomes leaky. So the vasculature becomes leaky and start producing the WBC. You see here, the WBC is going to the site of the infection. not to the tumor, it is going to the site of the infection. So WBC is going, and when WBC is going and vasculature becomes leaky, there is a fluid it is going to produce. When the WBC is reaching the infection, that fluid makes the tissue swell, which I mentioned in the dots. The tissue is going to swell, and the airway gets obstructed more from inside, not outside. Okay. When tumor is growing, the the epithelial cells are pushed from outside and inside. Airway is obstructed, and from inside also it's going to push. But when WBC is traveling, there is some fluid going to produce. That fluid is going to make the airway obstruction more tighter. Okay, so is this clear when infection is happening? Okay, so infection and immune reaction. So not only the immune system is responding to the infection, but also it responds to the tumor, because immune system recognize tumor as a foreign body, right? So immune response is also gonna respond to the tumor. So here we see fever. Okay, we see fever. Why this infection is there? I see a weight loss. Can anybody tell why? Weight loss. Why is weight loss caused? That's it. So weight loss is caused because there is a marathon going on here. Infection, immune reaction. Infection, immune reaction. Okay, and the foreign body, this tumor is there. Immune system start producing again the immunes. Then because of this thing, a lot of energy is gonna take. Because of this, even tumor is there is infection, so immune system is gonna work a lot. So there is a weight loss. So these are the main symptoms. These are the main symptoms which can be seen. Respiratory symptoms like coughing of blood, wheezing, or shortness of breath. We all know why it causes. And systemic symptoms like weight loss, weakness, fever. Symptoms due to cancer mass pressing on adjacent structures like chest pain, bone pain, superior vena cava obstruction, or difficulty swallowing. If cancer grows into the airways, it may obstruct airflow, causing breathing difficulties. The obstruction can lead to accumulation of secretions behind the blockage and predispose to pneumonia. We discussed if there is a pneumonia or any other infection, what happens, right? Is that clear? And this is the main thing we have to deal about this. There are the stages of lung cancer. Okay, there are 4 stages. Each stage is divided into A and B. 1A, 1B, 2A, 2A. So let's see each and every. Stage 1A and 1B. In stage 1A, the cancer size is up to 3 centimeters. Okay, and in stage 1B, cancer size is 5 centimeter up to. Okay, and in stage 2A, the cancer is either 5 to 7 centimeter, or the cancer is less than 5 centimeter, and there are cancer cells in lymph nodes. If there is stage 2A, the cancer cell, if it is more than 5 to 7 centimeter, if it is more than 5 centimeter, it should have extra something like in the lymph nodes, cancer cells in the lymph nodes. Okay. In stage 3A, this is the most dangerous stage. Stage 3A, if tumor is within 2 centimeter of the carina, this is stage 3A. Is that clear? If there is any doubt? Carina, and in this cancer is 7 centimeter or bigger, or cancer is in the main bronchi, or there are 2 tumors in the same lobe, or the cancer is growing into one of the following, like chest or nerve, or the lining of the heart or the diaphragm. Okay? Is that clear? And in stage 3B, cancer is in any size, and there are cancer cells in the lymph nodes, in the mediastinum, and in the heart and in other lobes. And stage 4 is that it not only present in the lungs but also in the lymph nodes, everywhere, and it passes the other organs also, like liver, cervix, prostate, and GI tract like that. So we got to make the diagnosis. The most common methods of lung cancer detection include, as you all know, chest X-ray.
No.
No. So what else it could be? Okay. Why not chest X-ray? Okay, maybe you can be a rich girl and you can spend for other things. But most of them, yeah. So most of them prefer X-ray because we can see it very clearly. Okay. Is that clear, Asuna?
Yes, Rahul.
Okay. And CT. So this is how we can see in the X-ray. It's a high density, it's something like this. Okay. And CT. And in CT we can see the tumor very clearly like this. And another thing is bronchoscopy. Bronchoscopy, you know, and biopsy through bronchoscopy will mostly deal. We can know definitely that there is a cancer or not. And sputum cytology, examination of cells in the phlegm. Treatment. Lung cancer surgery is to remove the entire tumor, including a small amount of normal tissue, about 2 centimeters at the margin, right? Just remember thing is 2 centimeters above the normal tissue. We have to remove the normal tissue so that it doesn't grow again. Because I told you one cell is going to be mutated or damaged, and it starts to growing abnormally. So we need to remove the 2 centimeters. And chemotherapy, lung cancer that cannot be removed. Some lung cancers are there, like in stage 3, which might be everywhere. And we know, but we cannot remove because it might damage the other organs. So for that, we need to do the chemotherapy, which is combined with radiotherapy. But there is a one defect in chemotherapy, that is when you do chemotherapy, it damages the other cell organs like skin and hair. So we lose the hair and skin becomes very tender. And radiation therapy, in patients with stage 1 or 2 non-small cell lung carcinoma, radiotherapy alone results in 39% of patients surviving to 5 years. And radiotherapy is done when we know the tumor is at particular site. Like I have a tumor in left lobe, in upper lobe, or somewhere. I know particularly we can do the radiotherapy in that way. So targeted treatment, as we know, we have medications for it. It goes and detects where which cell is damaged or mutated and take it off. Treats it. Immunotherapy.
Thank you. Can you show your activity for all the classmates? Yeah. Okay. I can. Which one?
I already copied most.
You all have been copied?
Yeah.
Oh, okay. My PPT is on the table, so if after the class, if anybody want to copy, we can show for each other. Okay. Balianta give more example for all the classmates. It's very good. It's very good. Okay. You